St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
A very good morning. Thank you for joining us on this live discussion that is being brought to you by Capuchin TV in conjunction with St. Mary's Mission Hospital in Langata. And today it's a very quite interesting day because we have a very nice topic that we shall be bringing you live from here in our studio. We're going to be talking about a PrEP. I'm sure you have maybe had this PrEP, or maybe you don't know about this. Well, worry not, because we have our guests in the studio who are expert in this field, and they will be talking to us everything about the information that you need to know. And the reason why we bring you this live event is because we want you guys to have information about everything that is happening in our world, around you, and everywhere you go. Well, my name is Maureen Kimani. Welcome to the discussion. And before we continue, I want to introduce to you my guest in the studio. Good morning, ladies.
Good morning.
How are you doing?
You're fine.
Very
Thank
okay.
You. Yeah.
You look beautiful, by the way.
Thank you.
Yeah, so maybe you can introduce yourself to our viewers, starting the person sitting right next to me.
Okay.
Yeah.
Good morning, everyone. I'd like to appreciate this morning because we have a lot to share. My name is Rhoda Nasiuma. I'm a program officer at St. Mary's Mission Hospital, overseeing HIV services. Yeah.
Thank you so much, Rhoda, for making time right here on Capuchin TV. Welcome. Yes, moving on.
Yeah, thank you very much. My name is Sophia Njau, working at St. Mary's as a HTS provider. So you are all welcome. Feel free to ask any questions that you may have. Welcome.
Thank you so much. Welcome too. And because you have talked about your department, maybe you can tell our viewer, what does it entail? Yeah.
Okay, so the CCC, which is an HIV program that is under St. Mary's, is a department that oversees HIV services, where we cater for testing services. We also have a follow-up on clients who are already on care, who are taking antiretrovirals. By this we mean clients who are on ARVs. We also have clients on PrEP. We also have clients who have been exposed to the hepatitis B vaccine, who come for their treatment. So we have also the TB treatment that we offer at the facility, and it's still under our department. And we also support the MCH, that is a maternal and child welfare clinic, concerning HIV services.
Okay, thank you so much, Madam Rhoda. What about Sophia? You can tell us a little bit about your department.
So basically is doing some HIV testing. We making people aware and counseling them, supporting them where we can. Yeah.
Well, we will know later the HIV testing. I'm sure it's very important for everyone to know their status. And moving on, in case to our view you have any question that you would like to authorize or our expert to talk about, you can text us on our SMS number, that is 21760, or our number, the other number phone, it's 0717 424 866. Welcome. Well, our topic today being PrEP. What does PrEP stand for?
Okay, PrEP stands for pre-exposure prophylaxis. PrEP is an antiretroviral drug that is mainly used in the prevention. It's a form of antiretroviral drug that is used by the HIV negative person to prevent them from contracting HIV. Yeah.
And how does this work?
So you're supposed to take, it depends there are those ones who come in and they have to be initiated on PrEP. So there's a process we have to take them through on how they'll be taking the medication. So for PrEP, it does not work below 72 hours. So you are supposed to take it within around 72 hours before you are exposed, but it becomes active within 7 days. Yeah. Yeah.
Okay, Madam Sophie, do you have something to add on that PrEP introduction?
So basically, PrEP is a pre-exposure prophylaxis. It is a strategy. It is a prevention strategy mainly used by a negative person who has tested HIV negative, who is on a substantial ongoing risk.
Okay, talking about the negative person, what about the positive people who are already exposed to HIV and AIDS?
Okay, so for those ones who are already HIV positive and confirmed, they are like now they have gone for testing and they are already confirmed that they are HIV positive. For those ones, we put them on antiretroviral, and it's a lifelong treatment. But for PrEP, it's not a lifelong treatment because it's usually taken by a negative person who is at risk of contracting the disease. But when the risk is removed, they get to stop. Yeah.
Okay, we understand we have a PrEP and we have PrEP. What is the difference between the two?
Okay, as we have said, PrEP is for prevention prior to being exposed to an HIV. Okay, not really an HIV person. You can say somebody that you don't know their status and they could be HIV infected. But for PrEP, it comes in after now the act. After you've had, let's say, sex or you've been exposed to somebody who you also maybe don't know the status, or you may be knowing the status, they are HIV positive, but now you've already undergone the act. So this comes in after the exposure. But PrEP comes in before you go for you get the exposure. Yeah.
Would you have to say that, Madam Sophia?
I'm in support with what Dr. has said. PrEP is a pre-exposure prophylaxis that is taken by a HIV negative person 7 days before an exposure. You take 7 days so that your body can create some immune. And now PrEP is a post-exposure prophylaxis that is taken within 72 hours of exposure and 20 days after. PrEP, you take it within a period of 28 days. But PrEP, you take it 7 days before, and then you continue taking PrEP as much as you are in that risk. But it is not a lifetime drug. You can stop it when you are not in risk. Yeah.
As a HTS counselor, it's a very nice thing when you tell people to do the self-testing, because there's no need for one going to sleep with another partner that they don't have any idea of their status. So what do you have to tell our viewer about that?
So what I'll say is self-care is very paramount. It is always good to know your HIV status, and it is always to pray safe sex for you to prevent yourself. And if maybe something occurs, or maybe you pray, you expose yourself, it is always to prevent yourself. We have PrEP, we have PrEP. Yeah.
Well, and Madam Sophia, as we continue, what are some of the indications of PrEP?
Thank you for that. So if you have a HIV positive partner, you take the HIV negative person takes PrEP to prevent themselves not to acquire HIV from the HIV positive partner. Also, if you have multiple sexual partners and you don't know their HIV status, it is always good to take PrEP. Also, if you inject drugs, because injecting drugs meaning maybe you are sharing the needles, so it is always good to take PrEP. And also even those who are coming to hospital with recurring STIs, that is sexually transmitted infections, and also for those who are coming for PrEP severally, we usually advise it is always good to take PrEP instead of taking PrEP now and then. Yeah.
And Madam Rhoda, concerning of what has been happening around us, we see even during our time for the airing of the news, we have seen so many partners killing each other. That means people out here are having multiple partners. What do you have to tell them?
Okay, so like we said, PrEP is used by the HIV negative partner. And we all know that you cannot force someone to go for HIV status. So as you still continue to convince your partner to go for HIV test, you can still use PrEP in those moments, until you get to know their status. Also, PrEP is used, as my colleague has said, it's also used to prevent yourself from infection, especially when you yourself, you have multiple partners, or you know your sexual partner has multiple sexual partners. Until now, you get to a moment where you'll agree, like, now we just stay the two of us and there's no that risk. Yeah.
I believe maybe even for some couples, they don't even know their partner's status.
Yeah.
You can't be even surprised about that.
Yeah.
Okay, what are some of the contradictions of PrEPs?
Okay, like maybe I can talk about that. Yeah, so like in PrEP, first, before we give you PrEP, we have to know your HIV status. So when you come for testing and then you turn HIV positive, we'll not initiate you on PrEP. So we'll give you the ARVs for that. Yeah. Then you also have to check your kidney functions. It's like that when you have a problem with the kidney, it means you cannot use PrEP because one of the drugs that is used in PrEP is excreted through the kidney. Yeah. Then we also have some follow-up that we need to be doing. Yeah. Like if you come for PrEP, after we evaluate your kidney, there are some follow-up or visits that you have to be making every 90 days. So it means on those occasions, if you won't be able to be coming for follow-up, we'll not be able to give you PrEP. Yeah, because it means you're at risk of probably injuring your kidney and you wouldn't know.
And how do you deal with that when a person just comes in for asking for PrEP and that you have to test them just to find they are negative. And some when they feel they're being tested HIV, no. How do you deal about that?
Well, our services are client centered. For one, you must be willing. We don't force. You must be willing. If you need PrEP, there is that criteria and there is that eligibility for you to take PrEP. One, you have to test negative. Second, you have to be very willing to take PrEP. And also, there are those medical tests that are done for your liver to test whether maybe you have any contraindications. Our services are just client-centered. If you don't want to, one, you must be willing. You tested negative.
Does that mean when a person just comes in the health center and maybe when you tell them you want to test them the HIV first and they say no, do you let that person go, or is there something you do maybe like a seminar or?
Okay, actually we have well-trained staff, very professional, so they get to take the client through the whole session of counseling. Yeah,
that is in St. Mary's Mission Hospital.
Yeah, but I believe even the others that are doing it outside because they are trained by the government actually. Yeah, so they get through the same process. So at the end of it is when the client now gets to give their consent whether they can be tested or not. Yeah.
So HTS and PrEP uptake it is a wide range of products whereby if you don't want to test for HIV, there is what we call pre-test counseling. We can give you pre-test counseling, and then when it comes to testing, if you don't want, there is what we call opt-out. So we just give you information, we do the pre-test counseling, and then if you're willing to do a test, we do the test. If you're not willing, it is okay. You can always go and come back any other time.
That's very nice. And Madam Rhoda, what is the most preferred regime of PrEP?
Okay, we have tenofovir and emtricitabine. It's a combination of two drugs, that you get to take daily, at your own time of choice.
So you have to take it daily?
Daily, it's a daily dose.
Okay. And the baseline investigation before PrEP, what are some of it? Maybe you can explain, Sophia.
Well, there is what we call lab investigation. That is a HIV testing. Your test must be negative for you to be eligible to take the test, for you to be eligible to take PrEP. So there is what we call lab, there is what we call willingness, there is what we call also you are willing to adhere to the drugs and also take them daily as prescribed by the doctor, and also there is what we call clinical, where doctor is investigating for the labs, the reactions, maybe side effects, the liver functions.
Okay, of which we'll talk about the side effects later, maybe after the break. But what are some of the when you are taking the PrEP, maybe what do you have to say about a person? Maybe they might feel they want to discontinue.
Yeah. So as we said, everything is an individual choice. Yeah. So if someone, because it's usually used for high-risk clients who are at a risk of getting HIV. So when someone feels that the risk is no longer there, you can stop. Yeah, or you can, if you feel at that particular time you're not okay taking it, you can still opt out. You come to the facility, you tell the provider that you're not willing to continue with the medication. Yeah.
Do they have to do a follow-up before they discontinue? Do they have to access, maybe talk to their doctor, or someone can just, you know, I'm tired of taking this medicine?
Yeah, so before we initiate you on the treatment, we get to talk about that. And sometimes it's also good to learn, like, why will somebody want to just stop the medication, so that when another client comes in, you can also have that information to support the other person. So we advise them to come back and also inform us that they don't want to no longer be on the medication, and then we just stop. We agree, yeah, like now you have stopped. Yeah, it's like that now the doctor doesn't remain waiting for the client who is already stopped the medication and they are no longer going to come for it.
Okay.
Yeah.
And then, Madam Sophia, after the discontinuation, how do you go about on the restarting the PrEP again?
So restarting PrEP again, it is based on the willingness of the client, and also if there is a substantial ongoing risk, and also we must repeat all the eligibility criteria again, so that we can start again the PrEP now.
Okay, I think moving on, we're doing very okay, and thank you for that information. And to our viewer, we are talking about our PrEP, that is pre-exposure prophylaxis. I know that the last one, it's quite difficult, maybe some of us cannot be able to pronounce, but don't worry, you can just stick with the PrEP. We're going to take a very short break. We will be right back talking about the side effects of this PrEP, and in case you have any question, kindly let us know, and we can be able to deal with it. Stay tuned.
Capuchin TV, your Catholic identity.
St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have a dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, And we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, your Catholic identity.
Second part of this health talk with me, Maureen Kimani, and in the studio we have two beautiful ladies. Just right next to me we have Rhoda, and my far right we have Sophia Njau. Welcome back as we continue with this discussion about PrEP, that is pre-exposure prophylaxis. Welcome back, ladies.
Thank you.
Yeah, as we continue, sorry about that. If a person takes a PrEP, do they have to continue it for the rest of their lives?
Okay, not really. Yeah. So PrEP is usually taken at the time where someone is exposed to a risk. Yeah. So when you get to deal with the risk and the risk is no longer there, then you get to stop PrEP. Yeah, so it's not a lifelong treatment.
Okay, yeah. Nice. And talking about the PrEP, we know every drug that is administered, sometimes it can react to our bodies.
Yeah.
What are some of the side effects of PrEPs? Maybe Sophia, you can take us through.
Every other thing or every other drug has got side effects, but we usually say if those side effects persist, it's always good to come back to hospital. Usually when you initiated to PrEP, you are given a 2 weeks visit. When you come, there are those things that we usually look whether you've been having any side effects, and if they are mild, we usually say you continue. If they are severe, it is always good to stop. Then maybe you can wait. Maybe you can use any other prevention method that is available for you.
Maybe, Rhoda, you can add to that, maybe specifying what are some of the side effects maybe one can be experiencing.
Yeah, so usually like all drugs have reactions. It all depends with an individual. Yeah, so the main ones we can talk about maybe the nausea, feeling to vomit, that is. Some of them develop abdominal discomfort. You can have some loose stool here and there. Yeah, then we also expect maybe a rash in some of the clients because we have very many people who react to different medications by getting a rash. Yeah. But there are those ones that you can react, as we say the renal conditions, those ones we have to investigate. So when they come for their follow-up visits, we get to check, to do blood tests, and then we check if they're okay. Yeah, so we'll do the liver function test, we'll do the renal function test, and then we'll give them the report. Yeah, so if they're okay, they get to continue the medication. But if the report is back and it's saying you have a problem, we'll talk to you and let you know if you can stop the treatment. Yeah.
I'm curious to know about these. Between the female and the male, who are more using the PrEP?
Well, most women, because of maybe trust issues with the partner or the spouse, most women tend to take PrEP more than men.
And then, the same case?
Yeah, okay. I would say yes and no, because it all depends with the person who is affected. But you can find that also men, they get to really use PrEP, because some of them, they don't want to use condom because their partner might find out that they have the condom and they'll have to explain themselves. But you know, PrEP is just a single dose. You can carry it around and all that. Yeah.
You can hide it.
You can hide it. Yeah.
Okay.
Yeah. But I also like to support whatever she's saying. Mostly women, because you find that most women, they're not able to advocate for their sexual rights, so they're not able to advocate for condom use. Yeah. So they'll just opt for PrEP. Yeah.
Okay. And talking about this PrEP, we know when it comes to medication, there is a certain age people are supposed to take this medicine. What about for PrEP? What is the age limit number?
Well, for PrEP, age limit is 15 years and above, and also you must be having or be weighing more than 35 kgs, 35 and above.
Yeah. But why 35 kgs?
Okay, because it's related to the drug. Yeah, so the tenofovir drug that we use in PrEP, you cannot give it to someone with less than 35 kgs because of the, as we say, the kidney issues. Yeah, so it is given above 35 kgs only.
All right. And I believe sometimes for people who don't have information, sometimes they are, misled by people. So knowing that there is myth and misconception about any of a disease or drug, what do you have to say? What are some of the misconceptions about PrEP?
Yeah, so we have several. Like we have some clients actually feel like when you take PrEP and you are on family planning, it might interfere with your family planning method. Yeah, so we also have others who feel like just in case they'll get the HIV virus, it means they'll not have any treatment for that because they can develop some resistance to it. Yeah.
And Sophia, do you have something to add on whatever she has said, knowing that young people or maybe adolescents or even women believe that when you're taking PrEP, you cannot get pregnant, or you cannot be able to get even the STIs. Is it true?
Well, what I will say is those misconceptions, it is always good to come to a health facility to get the right information. PrEP itself does not interfere with any family planning method. It doesn't make you maybe grow some resistance in future. Well, also PrEP does not prevent you from getting pregnancy. So it is always used as a combination method. Combination method with some condoms. Condoms can prevent you from getting pregnant. It can prevent you from getting STIs, the sexually transmitted diseases, while PrEP is preventing you from getting HIV. So PrEP is used as a combination method. It doesn't stand alone. Yeah.
Okay. And actually, in general, about our topic today, since we're talking about negative and the PrEP, that is the HIV, we are trying to make sure that we are not going to contract the HIV and AIDS. What do you have to tell partner? Because I feel sometimes they lack information, or maybe that person is afraid to go and do the testing. maybe if a person got tested and maybe you go and get a partner, or you have one, or you want to engage, involve yourself in sex, a person can be able to urge that person, you need to go and have your test, you need to be negative, otherwise I'm not down for that. What do you have to tell people who yet they don't know their status and maybe they're afraid to go and test?
Well, prevention all starts from knowing your HIV status. You can't prevent yourself from something you don't know. It is always good to take a HIV test, because if you take a HIV test, you'll be able to know, am I HIV negative, am I HIV positive? If I'm HIV positive, I'll be able to follow the guidelines that helps me to take these antiretroviral drugs to keep this virus not to replicate in my body, to keep my immune well. If I'm HIV negative, then I'll be able to develop a strategy of preventing myself and that of my partner. And it is always good to get tested together with your partner. And even if they are not there, or maybe they work far, it is always good to ask them maybe to go to a health facility that is near them to get a HIV test. If they are not able to come to the hospital, we usually have self-test kits that we show you the guidelines, how you're supposed to use them, then we give you take it to your partner. Yeah.
Prevention is better than cure.
Prevention is better than cure.
Yeah. And as a person, what can you say if maybe one wants to access these services? Where can one get them?
Okay,
Maybe
like
can do
all
that.
these services are available in the healthcare facilities, because PrEP is not found on over the counter or in chemists out there. You have to go to a health facility, then talk to a doctor, let them know that you need PrEP. Yeah, so you'll be taken through the process and PrEP will be available to you, because actually it's a free commodity. Yeah.
Okay. Yes. Do
So
you have something to add on
all
that?
these HIV services are free. It is always good to walk to an MOH facility that is near you, or even maybe the private sectors that offer HIV services. Yeah.
Okay. And can I ask you something? Does that mean sex is becoming dangerous? Because you have to, we can see we have PrEP, some they have, the contraceptives, and there is condom. What do you advise for our young girls?
Okay, I wouldn't say it is dangerous, but you see there are risks that are also involved. Rather than, like we say, get pregnant, you rather use a prevention for the pregnancy, use a family planning. But now, in the HIV sector, rather than somebody contracting the virus, now we have the PrEP and we also have the PEP. Because as we know, PrEP and PrEP they are drugs that can be stopped at some point. But when you start the ARVs, it's a lifelong treatment. Yeah.
Okay. And is there any diet when a person is taking PrEP?
No.
No? It's not like diabetes. So one is able to eat whatever they're craving for.
Yeah, to continue with their lifestyle, and their jobs.
Okay. And what do you have to say? Do you feel people have the right information, or do they have information about PrEP and the PEP?
Okay, I would say it's on the lower side, because we have most people actually coming in for PEP rather than coming in for PrEP. Yeah, so that's why we say even one of the indications for PrEP comes in at the many times that somebody has been exposed to PEP. Yeah, so we advocate that most people should seek advice from the medical facilities, such that they are able to get the right information rather than getting it on the internet from friends and all that.
And yes.
So what I say is PrEP information and PEP information is all over, in the social media, everywhere, in the social platforms. So it is always good, as much as you are getting this information from the social media, it is always good to come to a health facility where you get the experts. And you get the right information. Prevention is better than cure.
And creating awareness like we are doing right now. Thank you so much for coming. Do you have to add something about our topic today?
Yeah, I would like to say, let's prevent ourselves. Let's take PrEP. Yeah. Yeah.
Yes, Madam Sophia.
Oh, thank you. What I'll say is get to know your HIV status. After you've known your HIV status, you'll develop a strategy of preventing yourself. If you have tested HIV positive, there is a way of preventing you not to get other diseases or other infections that can take advantage of the compromised immune system. So it is always good to take a HIV test. Also get to know the HIV status of your partner. Develop a prevention strategy with your partner. Yeah.
Okay, and as a team of St. Mary's Mission Hospital in Langata, I'm sure you have these services you're offering to the people. When can they access them? Do you have a visiting day or hours they can be able to follow up?
Okay, I would say St. Mary's is a 24-hour hospital. So any client out there who has a need at any particular time, they are welcome to check with the hospital. They'll be advised, they'll be guided, and in case they need a special attention, the person will be brought on board for them. Yeah, so let them reach out. We are available 24 hours. Yeah.
And how about you, Madam Sophia, on your department that is for HIV counseling services?
Well, St. Mary's is a wonderful place. We are inviting all those who may need to know their HIV status, as our services are available all the days of the week, Monday, Tuesday, Wednesday, even on Sunday. Yeah. So come get tested, and our services are free.
Thank you so much, ladies. That is Rhoda Nasioma and Madam Sophia Njau for making time to our viewer to come in and enlighten them and make sure they have the right information about PrEP and PEP. I'm sure we can talk more and more about this conversation. Maybe we might continue because we haven't talked about PEP more. We have talked about PrEP. Maybe next time we shall plan about that. But thank you for making time on this conversation of the health talk right here on Capuchin TV. We really appreciate, so give our gratitude to the whole team of St. Mary's Mission Hospital when you get back. And thank you to the people that has been behind the camera. We have Felix Juma, who is our camera person. We have Mekon Degwa and Frank. We have Anthony Maina. We have Susan, Jesse the Icon, and Teresia. And lastly but not least, we have Michael Gatimo, who is our transmission manager, and not forgetting Frederick Ocheng, our sound operator or sound technician. Thank you so much for tuning in to this health talk. My name is Maureen Kimani. Have a blessed day. See you next time.
Capuchin TV, your Catholic identity.
St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even non-discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Muumini mpendwa, tunalo tumaini moja katika Bwana moja. Tuna imani moja katika ubatizo moja. Tumeunganika kama familia katika maisha ya parokia.
Kijana hapo penye huko mtaa